Сайн байцгаана уу? Өнөөдөр манай Defacto нэвтрүүлгийн зочноор Зүүн Финландын Их Сургуулийн, олон улсын Нийтийн, эрүүл мэндийн магистрын хөтөлбөрийн захирал профессор Юсси Кауханен оролцож байна.
Юсси Кауханен Зүүн Финландын Их Сургуулийн, олон улсын Нийтийн, эрүүл мэндийн магистрын хөтөлбөрийн захирал. Эмч мэргэжилтэй бөгөөд нийтийн эрүүл мэндийн чиглэлээр Финлянд болон Америкийн нэгдсэн улс, зарим Европын орнуудад суралцаж, мэргэжил дэвшлүүлсэн. Тархвар судлал болон нийтийн эрүүл мэндийн олон чиглэлээр олон улсын хамтарсан төсөл, хөтөлбөр, судалгаанд хэрэгжүүлж оролцсон ариун туршлагатай олон улсын эрдэм шинжилгээний мэргэжлийн сэтгүүлд 300 орчим шинжлэх ухааны өгүүлэл хэвлүүлсэн. Мөн түнчлэн олон тооны мэргэжлийн шүүмж, өгүүлэл, сонин хэвлэл болон дээд боловсролын материал хэвлүүлсэн. Финляндын Kuopioгийн их сургуулийн эмнэлгийн удирдах зөвлөхөөр олон жил ажиллаж байгаа. Мөн Зүүн Финляндын COVID-19 цар тахлыг хянах ажлын хэсгийн ахлах зөвлөхөөр ажиллаж байна.
Good evening.
Good evening.
Please tell us what brought you to Mongolia.
Well, I work as a professor at the University of Eastern Finland, and I have a background in medicine, but I work as a public health professor. We have this developing collaboration and exchange program with the Mongolia National University of Medical Sciences. So that's what brought me to Mongolia.
Is that first time?
That's my first time.
So let's talk about public health management. And there was a very successful, well-known worldwide project you have carried in Karelia, which helped people to live longer, I understand. Please tell us about that project.
Yes, indeed. It was pretty much exactly 50 years ago when people in Finland, in my home country, realized that too many young people, and especially young men, at their best working age, were dying from heart disease, also from other cardiovascular diseases like stroke, but very much from coronary heart disease. And very many did not reach the retirement age, and the disease, heart disease or death, touched almost every family, especially in the eastern Finland. So the people got worried, and a petition was filed from the people to the government. You have to do something. People are dying from heart disease. And that's how North Korea project started in early 1970s.
So what was the main reason at the end?
Well, it has been quite an amazing success story, because in those days, in early 1970s, 50 years ago, the mortality from heart disease and cardiovascular diseases were the highest in the world in that region, in eastern Finland. And statistics were showing that already then. And now when we look how things have developed within about 25 or 30 years, the mortality, that means the early deaths that especially men suffered from heart disease, they went down. They reduced by over 80% from the high level.
Wow.
That was a success.
So what made that decline?
Well, basically it was about just a handful of very simple things. In those days, that a region, North Karelia in eastern Finland, was pretty poor. Most people were farmers, lumberers, hardworking people, but their diet was not all that healthy. Their basic health needs were not probably monitored properly. Many had high blood pressure, and many were smokers. Over half of the people were smokers. So the project, when it was launched, was focusing on basically on three things: reducing blood pressure, high blood pressure, improving diet so that high cholesterol levels would go down, and third one was reduce smoking rates. So these three things, and a very, I would say, a comprehensive program was put up at different levels to fight these three simple things.
They also may be somehow connected with each other, but it should not be that easy to do so. Old habits die long. And what was the particular measure? Was it incentives? Was it social pressure? What is family education?
Well, you're absolutely right that it's never simple to change people's behavior. We have seen this same thing with many other health promotion programs that have been using actually North Korea project as a kind of a model, and these have been run all over the world and with very good plans, in some cases with very good funding, but every time the same problem is seen, it's difficult to change the behavior. Our health and lifestyle and health behavior, they are so deeply within our culture and in our psychosocial structure. But that required, as I said, a kind of multi-level approach in different ways. Not only by from top to bottom, telling people about giving information about healthy lifestyle, but working together with governmental, local, municipalities, governmental organizations, with private sector, with organizations, even with organizations like housewives club or organization in the region.
There was a so-called a dry law banning alcohol. And what was the reason, how long it continued, and when it is taken back?
Yes, in Finland, indeed, we did have a total ban for alcohol that was 100 years ago. That was very much, or that was much earlier than when this North Karelia project was performed. And the reason was that in early 20th century, it was believed in Finland that alcohol was the basic root cause for most health problems. It did cause a lot of problems in population and for the population health. So it was declared in 1919, and it lasted about 13 years. It was ended in 1932 by popular vote. People voted down. They didn't want to continue. And one of the reasons why people, and maybe not even the government, did not like it was that although the alcohol consumption went down for that period, the crime that was related to illegal alcohol did not. There was lots of smuggling, illegal alcohol trade, lots of even homicides, killing, and those kinds of things, violence. And it was all basically due to the fact that legal alcohol was not available, but there were all kinds of crime groups organizing these things illegally. So it didn't work very well.
It's very clear that in many countries, this kind of experiment, completely banning alcohol, always brought more illegal drinking, smuggling, more crimes, etc. And it's a very clear example, one of them in Finland. But 50 years ago, when you started this project in Karelia, it was not related to alcohol.
it was not considered to relate to alcohol so much. Later on, the research has shown that alcohol indeed is one of the important risk factors for also for cardiovascular disease as well as for cancers and many other, of course, injuries and violence. But in those days, the focus was really more on smoking, which was considered, and indeed was, in terms of cardiovascular disease, it was even a bigger problem than alcohol, absolutely, because more than half of the men were smokers, whereas right now, in Finland, maybe only 10% of men are smoking. This was just one sign that these risk factors can be changed. Also, the diet was, first, there was lots of resistance for healthier diet. People liked fatty food. They put lots of salt to their food. And that was maybe not so easy to start changing in that culture. But also now when we look at the contemporary Finnish diet, it includes lots of salads, vegetables, less fat, much, much less salt. And this also has been shown ultimately as better heart health. And alcohol, recently, we have paid more attention to it, indeed. Not banning it, but especially putting certain restrictions on advertisement and for accessibility of alcohol to younger people and those kinds of things.
Finland, one of the expensive countries in the world. Have been several times, I know what it is. Today, what is the, when you go to shop, what is the price for the box of, longer box with 10 of cigarettes?
Oh my.
Say Marlboro.
I can't quite remember. I have been buying cigarettes for a decade myself. As a young guy, I used to smoke as well. But it is maybe around almost 10 euros or something like that. So it's very expensive. It's heavily taxed.
No.
Yes. Yes. And so the price has gone up remarkably over the year. In fact, as part of this North Korea project, the very important legislation was passed in 1976 that was called National Smoking Act. Or Tobacco Act. And it was the first time when there was age limits to smoking and buying cigarettes. There were some other limits. And many, many times after that, this legislation has been upgraded and more restrictions has been added. And also the taxing has become heavier. So it is expensive nowadays.
Again, for the, say, alcohol, typical, we know the absolute size, almost 700 maybe grams or 1 liter. That alcohol, how much does it cost?
That is also, in European comparison, it is expensive because the alcohol tax in Finland nowadays is higher than in most other European countries. That standard box, and you mean, for example, spirits like vodka or something, would be about 20 euros. So compared to cigarettes, it's comparatively cheaper. But
I'm asking these questions because all this thing has to do with the economics, the level of living standards, etc. 50 years ago, Karelia was less competitive, more farming. What is it is today? What made the people change?
I think there, in addition to all the efforts by the project itself, and it really happened at the community level, people were really much involved. Local activity groups, housewives, like I mentioned, even local grocery stores, and they changed the culture, I would say. But in the background, of course, we had this great social change from farming to services to some more contemporary branch of industry. Also, the population have in part moved away from that region to cities in southern Finland and so forth. So nowadays, the average wealth or income level in the region is much higher. It used to be a poor region, poor rural region in 1970s. Nowadays, it looks pretty much, well, in fact, it's still the same, beautiful nature, everything, farms, but less farms, and they are larger.
The economy in Finland is so now developed, and the per capita income one of the highest in the Scandinavian countries, including Finland. So with the growth of economy, with the per capita income of the country, public health sector is to be also correlated with that, right? The health of the public.
Well, generally, and when you look at global statistics, there is a high correlation between general economic well-being and public health. But it's not 100%, of course, true. In some countries still waste their resources and do not invest. Even they are rich, and high-income countries, they don't invest enough into, let's say, public health services and promote people's health. In Finland, I would say that the project in 1970s was just one sign of sort of like general attitude that I call public health approach. Even when Finland was what one might call middle-income country in 1970s, we still already wanted to invest in public health a lot. Nowadays, of course, we still invest, but compared to the contemporary income level and economic prosperity, I think we nowadays invest comparably little as compared to 1970s.
I see. The health situation in a country sometimes is also measured by the percentage of GDP spent for health care. What is that level in Finland, and what is optimal level?
It's difficult to say what the optimal level would be. It depends. Some countries are able to do provide their healthcare system in a very cost-effective way, and some others, again, are wasting money. Finland spends pretty much the OECD average, and it's hovers somewhere around 10% or even a little less. But it's not, as I said, the best measure. I think Finland has been able to provide some services fairly cost-effectively as compared to, let's say, United States, which puts twice as much money per capita to healthcare, but some of the health outcomes that they get are worse than in Finland. So
why is that would be?
There's, too much spending on maybe not the priority areas, to some expensive services that only serve a certain part of the population, and big part of the population with basic public health needs are sort of left out. And there are all kinds of factors that health economists could talk more about. But really, it's not only always how much money, it's also how you spend that money.
Yeah, that's true. In Finland, people live much better now, as like other countries. It has to do with the also education, health education. How you give the people health education?
Well, I think, again, if we go back 50 years in 1970s, health education was a very important part of North Korea project. For example, the general level of education among the population was fairly poor. Many people only had primary education. Nowadays, of course, most people have gone to obtain secondary education and increasing number maybe have almost a kind of college education. So nowadays, when you talk about health education, it's not the meaning is not the same. People are already fairly educated, but you have to embed. That's, I think, the kind of building up the healthy knowledge about well-being and health into the curriculum in schools and all through the education from preschool to the colleges. And that's what they, in part, are trying to do in Finnish education system.
In education, by the way, you almost number one in the world by many tests, or by many outcomes, I would say. So all the schools are free?
Indeed. All education, as I said, from preschool to universities, is basically free or at some point very low cost. That's true, but of course it's funded by mostly from public funds. That means taxpayers' money.
Yes. You have very high tax.
Yeah, the tax rates are fairly high, just like they are in all Scandinavian countries.
On the income, which level? Half?
Yeah, you might say roughly half what many people pay out of their income as taxes.
Okay, so education is free, of high quality. The students' amount in their classroom is very little, 15 or so. And how about hospital treatment, medical treatment? Is it also free, or you pay? How much you pay?
Hospital system, healthcare system, basically is I think the most important characteristic of it is in Finland that there is universal coverage. Everyone is covered, and they will reach or receive the care they need. Of course, there are some additional elements. Some people provide or buy private insurances and get extra services from private sector. Also, there is an additional system of occupational health for those who are in work life. But it's mainly, again, paid by the government and with the tax money-based subsidies. But, of course, there's some out-of-the-pocket fees, which are modest.
You said the universal coverage. Is it by insurance company, state-owned, or private?
It's based by the Finnish national social security system. It's basically a national health insurance that covers everyone, and so it's not based on agreements with private insurance companies.
So basically, anybody who goes to a hospital, doctor, everything is paid by that coverage.
Yeah, almost everything is paid. Then, of course, we know that there are certain very, very expensive treatments where there needs to be decisions not based on who you are, but based on if the system itself is able to afford this, or do we have to prioritize? But basically, the driving force tries to be equity in these services for everyone.
Equity. Are there private hospitals or all the state-owned hospitals?
There are private hospitals, but most hospitals, even the top hospitals, most of them are public. But there are some, and it's actually slowly growing industry in healthcare, but still not in a major role.
In also education system, are there private schools there?
Very few. Most of the schools are public schools, and again run by municipalities with public funds.
Schools are run by
municipalities, yes, but there are certain national general guidelines, regulations also how it should be done, but very much freedom is also left to municipalities to do some of the choices of their own, how to, for example, reach certain educational goals.
In Mongolian public health care system, we have both private and public, in the schools as well. In particular in schools, it is increasing inequality. People who can pay getting better education. Was it in Finland all the time? The schools were always public, or there was a private, or how you have this universal equal education quality you are providing?
Well, it has not always been like that. If we go back history to pre-World War II days, only the very basic primary education was for everyone, every child. But the welfare state, as we say, providing this basically free education also at the secondary and tertiary level to all people, that was created starting from 1950s and 60s, and it was built. I think it reached its current form in late 70s, in 1980s. So it's not an old system.
A little bit about your program. You are International Master Program Director.
Yes,
right?
We do run an international master's program in public health, Master of Public Health program at the University of Eastern Finland, Kuopio, which is the city where I come from. We have two major campuses, but our health Faculty of Health Sciences and this public health program is run in Kuopio. And we have lots of international students every year coming from different parts of the world to the program.
Including Mongolians?
We have had Mongolian students, even this spring, but they have been with us for a shorter period of time, just for a few months or so. So we would very much... Well, I don't know if there's still enough awareness of our program in Mongolia. We would very much welcome applicants from Mongolia to apply. It's the end of every year, the next application round. And so I welcome people with, for example, a background in medicine or nursing or health sciences or any related field, even social sciences or so, to try and see if they would be interested to join the ranks of our student body.
In a public health education system, you are not necessarily to be a doctor, medical doctor, right? From any field, you can be involved in that program. And is it this program for 1 year, or how one to involve?
It's a program of 2 years of full studies.
2 years.
And it gives kind of wide basic preparedness for a variety of tasks in health sectors. People who have graduated from us have worked in health ministries, in international agencies, in NGOs, in public health work. Some have continued, if they had already a medical doctor degree behind, or medical studies prior to coming to Kuopio, they just get this additional degree from us and then may become health administrators or something in their home country. Some stay in Finland and are active, for example, in research.
How expensive is this program?
There is a tuition fee which is roughly 10,000 euros per year, so the program altogether will be 20,000, but we automatically give students a 70% scholarship for the first year, and if they proceed well with their studies, they also get the 70% discount for the next year, the scholarship, yes.
Actually, it may cost only 3,000 for first year. And tuition fee, how about the accommodation?
The living costs, as you said, Finland is a fairly expensive country. Fortunately, we are not the most expensive country in European Union, and even some of the other Nordic countries are more expensive. But yes, indeed. But we have fairly good and fairly cheap and affordable student housing. They are neat and high quality in Kuopio, very low cost, healthy student meals available and those kinds of things to help people to cover the living costs.
So many international students.
Yes, indeed, from Asia, from Africa, from North America. We also have students from other European countries, but they usually come only for, again, as exchange students for a few months or half a year or so.
So all education goes in English?
It's in English, yes.
Is Finnish required?
Finnish is not required, but we offer students an opportunity to start studying Finnish language, and many of them do.
Well, very interesting conversation to know more about Finnish health education sector, and thank you very much for coming and being at my show, and good luck for your project in Mongolia.
Thank you.
За хүн үзэгчдээ өнөөдөр манай Defacto нэвтрүүлгийн зочноор Зүүн Финландын Их Сургуулийн олон улсын Нийтийн эрүүл мэндийн магистрын програмын захирал профессор Юсси Кауханен оролцлоо. Баярлалаа.